Hello everybody. Today we are going to discuss about the cut and wounds of the great kid. Most wounds can be treated at home and will start to heal within a couple of days. However, some of the wounds may need to be treated by a medical professional. So we just will give some, discussion about how you will decide when your child will need immediate attention by medical professional or whether you can treat at home, and that will be the main logistic of doing this healthy talk today. So red signs that you have to keep looking of your child, that one of the following: that if cut is not stop bleeding after 20 minutes of direct pressure, and the blood comes out in spots and it bright red in color and hard to control, and loss of sensation or feeling near the wound and has trouble moving that area. A bad cut on the face or palm of your hand, means kid's hand. A wound that is large and deep, showing the fatty tissues, muscles or bone, and there is something stuck in the cut, such as a shred of glass. Do not try to take out yourself. Yeah, so what you have to do, you have to go to the accident and emergency immediately or call 999. And comments in the meantime, remove all the clothing and jewelry around the injury. Stopped bleeding by applying pressure on the wound with a clean cloth and elevate the injured area if possible. So these are the red signs I mentioned that you have to look for your child's cut and wound. Now I'm going to the amber sign. That's not that dangerous like what I have already mentioned, but you have to take care. First of all, is if your that cut is deeper than 1 centimeter, or that you cannot see the bottom of that wound, and if that wound is showing any sign of infection like redness, pus from the wound side that become very hot and swelling in that area, and a wound that results of human or animal bite and swelling around the injury that is not improving, and there is pain even after 48 hours after that injury. In that case, you can call in NHS area 111 or go to your urgent care center or minor injury center. And in the meantime, you have to do some first aid, like remove any clothing, any jewelry around that injured area. Stop the bleeding by applying pressure with a clean cloth. Elevate the injured area if possible. Keep that injured area still. Do not try to move it. So these are the things, that is yellow signs I mentioned. Now I'm going to tell about green things. Means if those what I have already mentioned not there, then you can continue to provide your child care at home. So you can do that yourself. What are the things you can do at home? Wash that. Means wash the wound. Wash your hand thoroughly by soap and water. Wash the cut with a cool water. Gently remove the darts and debris if present in and if present there, to prevent any infection. Use direct pressure elevate to control the bleeding or swelling. Pat the area dry with a clean cloth. Put a sterile dressing or plaster. Apply ice if child has bruising or swelling. Use a thin towel between the eyes and your skin. Avoid picking at the scabs. Apply sun's protection until the wound is completely healed. New skin will burn easily and may cause added scarring. Pain relief, you can give paracetamol or ibuprofen as required. Do not exceed any recommended dose that on the level of the medication. So this is all about taking care of a child with cuts and wounds. Hope that helps. Little talk helps, and we will come with another little talk, healthy talk, next week. Bye for today.